This is Lipedema Podcast, Living with Lipedema. Here's your host, Sarah.
Hi, I'm Sarah, the host of Lipedema. In this episode, we have a special guest, Yana Etemadi, an expert functional nutritionist. She too has lipedema and understands the struggles. Welcome back, Yana.
Thank you, Sarah. We had a really good hour with you last time where we went through such an awesome information.
It was great. If you haven't heard it, go back and listen to the first episode with Yana. It was wonderful.
Yeah, everything what we will talk with you today definitely will has to be start from the last conversation.
Yes, it does. It does. So go back and listen to the first one if you haven't yet. So today we're going to be discussing things that can be helpful before and after surgery. So do you want to kind of talk us through prepping for surgery?
Most of all, of course, just understanding the surgery, and the women with lipedema more often have several surgeries back to back, and we need to understand, and we need to just embrace understanding what is, and really have a good clear picture what is happening with our body. This surgery is hard on the body. It's very invasive. It's very rough. It's a serious stuff. There are tissues being removed, skin being ripped. It's just not a small cut with the small things removed, and it is very invasive, very serious surgery, and the body needs to heal after that. So to come to the surgery, to make sure your body is prepared for this fight. It will be a fight, and it will be a huge battle for your health and for restoration, and to make sure that you're ready for that. That is the most important. It's, for example, when you decided to do the repairs in the house, and here, if I will say, okay, from tomorrow I will do the repairs, and I start demolishing everything in the house, but then I go to my bank and there is zero money in the bank. Yeah, how far I will go in my repair? It will be very hard to fix what I demolish in the house.
No.
So I need to prepare for this demolishing probably and get some money in my account. So if I'm repair everything I ruin, I would have money to pay for all this repair. The same thing with the surgery. You need to prepare your body for this serious recovery, especially if you have back to back, especially if you have several surgeries 3 months or 4 months apart. You need to make sure your body has enough resources, amino acids, vitamins, minerals, good microbiome. Everything has to be ready for this recovery. This is first. Second, you need to make sure you don't have inflammation, because surgery, huge inflammation. And if you're coming to the surgery with a high inflamed body, what are your chances of healthy and good, fast recovery? Your chances are lowering pretty seriously after that. So you need to make sure that you have faster recovery, as I will not say pain-free, but as controlled pain as possible. You have to reduce risk of infections and any kind of, and start be able to move and to be able to heal faster. And for that, you need to make sure that your level of inflammation is very low coming into the surgery, because you will end up with the high inflammation. So if your level of inflammation here after surgery, you will be here. Imagine if you come to the surgery with level here. So the body will go out of control with that. So let's just prepare for that every way. So give the reduce inflammation and give your body plenty of nutrients to repair itself after. So this is super important.
It is super important. Talk to us about how vital nutrition is before and after surgery. What are some things that people can change about what they're eating that would help their body heal faster?
Yeah. So to reduce the inflammation, that I very much suggest to start preparing for the surgery. It's just like with insurance. Those who have with insurance, you're doing it month and month before you start collecting the papers. You have to start preparing for the surgery, nutrition, and also way, way before. And you should take like several months, if not half a year or a year to prepare, because I do suggest always go through autoimmune paleo diet. It's also called anti-inflammatory diet. And this is the diet that where you remove all the food that potentially can cause inflammation. And with this diet, remove things that you might think is healthy. Eggs, actually, it's a healthy food. Nightshades, I mean, tomatoes, this is vegetables, and beans and legumes, they give you fiber. This is also good, healthy food. But there are a lot of bodies that cannot tolerate even food that consider healthy. So that's why this autoimmune paleo diet or anti-inflammatory diet, removing all the foods that potentially can cause inflammation. So to go through this diet and make sure you're not eating the food that adding inflammation to your body. Also, I'm very much recommending to go ketogenic diet already closer to the surgery, because and go clean keto. There are different kind of keto. There is dirty keto and there is clean keto. Dirty keto is where we making keto adapted desserts, fat bombs, and all other stuff that's considered dirty keto. And I'm not talking about this. We're doing nice, clean, healthy keto and dairy-free keto as well, because keto do allow dairy, and I suggest dairy-free keto. And to go keto close to the surgery and go into the surgery in the good, healthy, high ketosis. Why? Because first you might be hungry, but you will not be able to eat a lot after surgery, and ketosis will make sure you can go without food for longer, and you will not wake up hungry. Hungry and angry together, and you will not get this horrible sugar popsicle that they might offer you and just get everything, just get inflammation out of control on top of what is happening. And second, ketones themselves, they're very anti-inflammatory. They're super anti-inflammatory. And I do use ketogenic diet in some the diseases, some with, especially with kids with autism or any kind of with the inflammation, neurological problem or brain inflammation or the body inflammation, like very, very big inflammation on the body, or for example, people who go through chemotherapy. So ketones are extremely low in the anti-inflammatory. So having high ketones in the body when you go to the surgery will also help to address and reduce the inflammation. So that's why you're doing. So you're doing AIP. You're reducing the inflammation, you're removing the food you potentially can be inflamed, and then you're getting into the clean dairy-free keto and going into the ketosis to the surgery.
Does this, there was a question that came in from our listeners. Does keto deplete microbiome?
Absolutely, yes, it does. Keto does deplete microbiome, and that's why I don't actually suggest, especially for women, I don't suggest to go keto for very long period of time. And it's actually ketosis also not very friendly to the hormones. That's why there is such thing as the carb cycling. And I do suggest women do carb cycling, those who does keto. And keto does deplete microbiome because there is a small amount of fiber. And that's why, yes, adding prebiotic and good high quality probiotic during the ketogenic diet will be very, very helpful. But also I'm not suggesting doing it for very long time. You can just do it during the surgery and then go back on the nice healthy eating, the way you were eating, nice healthy way after the surgery. It will just help you to go through this surgery time.
Can you go a little deeper into the prebiotics and the probiotics?
So prebiotics, this is the prebiotics, this is the food for bacteria. So probiotics, This is different than fermented food. This is important to understand, because fermented food is just the food that contains some bacteria, positive bacteria for your health. But because we don't know how much of this bacteria, what exactly bacteria is there, we understand approximately like this is bacteria that's supposed to be there, but especially if it's wild fermentation, that could be other bacteria coming. So because we don't know exactly what is there and exactly how much of bacteria there, it's not qualified to be said that this is a probiotic. This is just fermented food that contains some bacteria strain that is good for our gut. So this is fermented food, which is always good to add. This is fantastic, but you cannot say I'm having probiotic if you're eating just fermented food. So probiotic, this is something you're getting in the pills. Usually it could come in the powder, but usually you're getting in the pills, and that's already, it has to be researched. And one of the things I want to say to your listeners, more is not better with probiotics. If you're getting a bottle that say 100 billion strain, everything there and all that stuff, it doesn't mean it's better than the one that has 1 or 2 strains. Sometimes 1 or 2 strain will be way better. So that's a little bit tricky to understand, because sometimes we think the more thing, the merrier thing. But usually just look at the label always and see what the labels say. And because the label on probiotic are very nicely regulated. So, and probiotic will say, claim, and will not say bacteria does this and that for your intestine. The probiotic will do so good and will help with this and this and that. That is very vague statement. The good probiotic, well-researched, will say, this probiotic will do this, and this strain will get this. So they will have particular health claims about this strain, about this probiotic. They will not say just probiotic in general. They will say particular, this probiotic will do this and this and that. And that's mean this strain or this combination of strains are researched. There is a paper about this. There is a proven sign that this probiotic, if you will take it according to serving dose, you will get these results. So this is the best way to choose it. Probiotic. So probiotic is the bacteria that you eating. So this is the pills and you digesting it. A lot of company does enteric coating, so it will survive in your stomach acid and get to your small intestine to be absorbed. And they are, so here there is the division. Some say that this bacteria colonize your intestine. Some say that this bacteria is sending the signal to this bacteria to be developed in your intestine. So here is, I cannot tell you exactly what's happened, but I can tell you that if you're taking it, means this bacteria will end up in your intestine and will start to populate. So you will increase more good guys than bad guys. You will increase that. So this is first, but prebiotic. Again, there are fibers, and this is prebiotic. Again, this is different. So prebiotic, it is the thing that feed this bacteria, and bacteria, different bacteria eat different food, different prebiotic. So just like in the zoo, you're not having the same food for each animal in the zoo. You will have one for lion, one for bunny, and one for the snake. The same bacteria is the same pets. So it's like a zoo in your intestine, and each bacteria will like the different stuff. So that's why the probiotic has to be with different spectrum. So there should be combination of different prebiotics to feed the bacteria. So this is the difference on probiotic and prebiotic. And of course, you have to be careful, especially with the prebiotic and with the probiotic as well. If you have any kind of bloating, you have SIBO, you have muscle activation syndrome. So with all of those, you really have to be careful and work with professional to choose probiotic or prebiotic, because some of them can end up giving you cramps, bloating, pain, because it's this has to be considered. And some probiotic prone to is for constipation, more constipated people, for more diarrhea people. So it has to be chosen according to what is your condition. It's better not just to choose something. So you cannot just say, I'm taking probiotic. I'm always saying, what are you taking? What exactly are you taking?
Yeah. So for those who may be new and go, oh, I don't know what to do, and they've heard anti-inflammatory diet, keto, carb cycling, can you, for those that are maybe freaking out going, I don't know what to do, can you kind of tell them, here's kind of how you can do it or where to start?
Yeah. Of course, my best recommendation would be to come to the professional like me.
Yes.
Because it will be my best. The thing is, it's I started 17 years ago, and the problem there was not enough information. I could not find anything. And of course, back then also the language was my huge barrier, but I could not really find, because the internet was not that big and there was not enough conferences, there was not enough information. Now we on totally different side of the spectrum. We have too much information, and every trainer in the gym think that specialist in nutrition, every person who did 3-day course already nutritionist and give you advices. And that is one of the reasons I went to get my master's, because I really wanted to know what advices I'm giving and get to this level of education. So the best way is really to go to the specialist, because especially with lipedema, a lot of people with lipedema has mast cell activation. A lot of women with lipedema very, very much prone to have any problem with the thyroid or already full-blown Hashimoto. So this kind of stuff, and the person will adjust the diet for you. To do it yourself, it's hard, because you need to understand what you're doing. You need to sometimes diet is not enough. You need to have the support for your intestine. You need support to have some omega, some anti-inflammatory things like probiotic, prebiotic. So it's best when the person is really building individualized plan, especially if you're getting ready for the surgeries, and just to build up everything what specifically you need. And that's why it's I can give the whole lecture about AIP diet and keto and carb cycling and how it's work, or you can find this information out there in internet a lot, but not everything what I said will work for every woman.
Right.
This is very general recommendation, but there might be out of 10 women that will come to me. I will, maybe for 2 of them, I will say, that's not going to work for you. We will go different route. That might make you feel worse. So that's why my recommendation, they're very for the general crowd that will work for most of the people. But I cannot say that my recommendation will work 100% for everyone. And there would not be a case that's picture is not working. And that's why we exist. And that's why I have private practice where I work one-on-one, right, just to create something that works just for this person.
And we do need it individualized. There's not a one size fits all for us.
Yeah. And it's not like we have lipedema, that's it. We fit on the box, right, and there is the plan. Again, we might have the same condition. If you will take several chains, like 10, 20 chains, and you just pull it on the side like that, they will get broken in different places. Where's the weak link? So we did the same action, we pull it, but the breakage will be, one chain will break here, one chain will be break there. So we do have lipedema, but the effect of it will be different from every person, and maybe cause of it will be different in every person. It could be just in your genes, or it could be very much estrogen related, or it could be anything like hormone more related. I'm not saying that if it's hormone related, it's not estrogen related, or hormone estrogen is pretty much the same, of course, but I'm just saying that it could be triggered for something else. And I might suspect mold. I might suspect a nutritional deficiency. I might suspect different stuff. So again, the approach has to be very, very individualized, just to fit in your goals and just to see what is your history of diseases, antibiotic use, and the whole journey that you took, and where are you now? Like
Right.
some people are already clean up their diet and ready for the further step. I have people who coming and we're working just to removing soda from the diet and getting them off the sugar, because sugar is a huge addiction. We're getting just off the sugar. So that is also depend. Like, for example, if you are still eating sugar, for you have sugar addiction and you still have trouble with the carbs, I would not suggest to jump on autoimmune paleo or keto tomorrow. That's just not gonna work. It will make things worse. So we have to gradually make a plan getting you there.
So yeah, if somebody says this works for me, it doesn't mean it's going to work for you. So don't freak out. I highly suggest reaching out to Yana. Yana, tell people how they can contact you, because I think everybody needs to see you, myself.
Thank you. Yeah, everyone can find my email address, my phone on my website is foodasmedicine.online, foodasmedicineonline.com, online. So also you can find me, of course, on the Facebook page. I'm part of the Lipedema Cafe group, of course, and you can find me on all the social media. And but foodasmedicine.online is my website where you can have my phone number, and this is my cell. You can text me and we can arrange the meeting. Absolutely. And I am giving a pretty serious discount on the hourly led to lipedema clients, because I know this journey cost a lot of money. So I do have 50% discount on my hourly rate for lipedema clients.
That's amazing.
I cannot not do this for my Libby sisters.
No, it's so amazing. I'm super thankful, and I wouldn't tell somebody to go sign up with Yana if I didn't believe in her. And I too have made an appointment with her, and she has given me great wealth of information to further my education and my health journey too. And so I think it's just vital to get somebody in your corner. It's going to be worth it. I promise you. We did have one last question that came in from one of the listeners, and it said, what post-op diet would you recommend for your patients to help flush out anesthesia?
Yes. So that is a great question, because yes, flushing out all the detox anesthesia or any kind of things that doctors might give you. Also, I know there are doctors who like to, it's nothing bad in that, but this is the approach. They like to give antibiotics for clients after surgery, and to prevent the risk of infection or just for the healing. So, and some doctors doing it a week, some doing 3 weeks. So this is different. And again, nothing bad. And if that's their approach, that is perfect. It's work for them. And that's the area they choose. And that's why it's good to work with nutritionists to really supplement the work of doctor. And again, each doctor, especially with the surgery, each doctor will have their own approach, and nutritionists can adjust to the approach of the doctor. So I will not say to you, tell doctor to do this because I said so. So doctor is in charge there. He's the one that making all the decision and pulling on the strings. So my job is to adjust my recommendation to doctor's decisions. So, and that's why having a good diet to restore, it's super, super important. So most of all, always start, first of all, don't take slushy in the hospital. This is food coloring with sugar. You don't need it. Your body doesn't need it after what it's went through. Start with bone broth. Perfect. And you would need some, doctor might recommend some glucose. So have some fresh squeezed orange juice or beet juice is amazing. Beets has a lot of nitric oxide that will help also reduce inflammation. So beet juice is amazing. So orange, like I like apple juice with beet juice. It's yum, yum, yum. So apple juice with beet juice will be great if doctor wants some glucose. So also the bone broth is amazing. But to help with the detox, of course, supporting you can use different herbs to help to detox the medication. So for example, milk thistle, amazing to help with the liver function with the detox. Dandelion root, this is help cleanse the liver, help cleanse the kidney. Turmeric is help with reduce inflammation and also detoxify. Ginger, also amazing. So make like tea out of that. You can use essential oils, lemon essential oils, peppermint, lavender, grapefruit. So essential oils like that will help you to reduce inflammation. Also in the diet, again, make sure it's anti-inflammatory diet. Use a lot of cruciferous vegetables. Cruciferous vegetables amazing, helping to detoxify your body. So have all the cruciferous vegetables, the cabbage, cauliflower, Brussels sprouts. This is all your cruciferous. Just have them and eat them daily. Also, having protein, extremely important. Our liver has 3 stages of detox, with 2 that happening in the liver, and 3rd is detoxification itself. Make sure you using bathroom, you have bowel movements daily. This is part of you detox is daily bowel movements. If you on the supplement or if your medication that making you constipation, again, you can use just out-of-counter milk of magnesia or Workman Nutritionist, where I'm adding probiotic and prebiotic to move the bowel movements, but having daily poop, that is the best detox. Cruciferous vegetable, again, the two parts of the liver detox. Second part of the liver detox needs a lot of amino acids. That's why having good all essential amino acids, the whole array of amino acids, the proteins, extremely important to detox everything. Also, what we're doing, working on lymphatic system, big deal. All the supplements, rosemary oil is fantastic for lymphatic system, and everything what we're doing. Of course, ask your doctor, is it okay to do all the walking is great. Stretching is amazing. As soon as you can, of course, rebounder and vibration plate, as soon as the doctor allowed to do this. So moving lymphatic and moving your body and try to walk, do all this small stretching, fascia movement, amazing for the detox. Of course, sauna is awesome, dry brushing. So all kind of stuff to move your lymph, to make sure you have daily bowel movements, to make sure you're using this herbs and essential oils, and make sure that you just move and you're working your body and having a good high quality diet.
I love it.
Yep.
Yana, thank you. This has been great information. I love it so much. I can't wait till our next one. You guys, the next one coming up, our next episode will be on mast cell activation. I cannot wait to delve into this topic. And if you have questions, let us know. You can email me at lipichalista@gmail.com or visit the website lipichalista.com and get us those questions in, and we will get them through to Anya so she can.
I'm very excited about this talk, especially as this conference, Dr. Herbs, she mentioned that she does see people with mast cell activation. And unfortunately, this topic was not moved forward after that. She just mentioned, and me participating in a lot of chat after that, one of the things I heard is like, what's that? I'm like, ooh,
we're gonna talk about it.
So yeah, let's talk about this and explain to people what's mast cell activation.
Yes.
What to do about this. It is not easy thing to deal with. Absolutely, it's hard, but again, there is light in the end of the tunnel. It could be work, and addressing it correctly will definitely remove some of the symptoms and make people breathe.
Well, I'm looking forward to it. And I know that our listeners are too. Yana, thank you so much for being here with us today. I appreciate you.
Of course, thank you so much for inviting and giving me the platform to share my knowledge and giving my suggestion to people. So thank you so much.
Absolutely.
Okay, I'll see you soon.
See you soon.
We hope you enjoyed that podcast. Content on this podcast is for educational purposes only, is not intended to be a substitute for professional medical advice, diagnosis, or treatment. To learn more about the podcast, visit the website lippychalista.com or email Sarah at lippychalista@gmail.com. She is also a certified life coach and financial coach. For a free consultation, visit the website jacksonlifecoach.com or email her at jacksonlifecoach@gmail.com.